Hello, so I've been in general practice for 25 years, longer before I'd even heard about neuroendocrine neoplasms. And although I like to think I'm a GP that takes an interest in lifelong learning and broadening my experience as I go through my career, the first time I came across neuroendocrine neoplasm was when I was diagnosed myself with a small bowel neuroendocrine tumour. My story, like many other people's story with small bowel tumours, is that I'd had recurrent abdominal pain, been investigated by various gastroenterologists, but it took very many years to come to my diagnosis. And that's a story that's so familiar, with the average lead-in time anything up to 7 years between initial symptoms and diagnosis. Of course, one of the big challenges working in primary care is that we're often seeing people at the beginning of their experience. We're seeing a lot of common, relatively minor illnesses, and we may not be thinking about neuroendocrine neoplasms as a possible tumour. But yes, how can we be more aware of the prevalence of neuroendocrine tumour? Because the latest figures are that there's actually more prevalence of neuroendocrine neoplasms than, for example, carcinoma of the pancreas. So what would my advice be to my fellow colleagues? Well, we need to be aware of the fact that neuroendocrine neoplasms exist. They're becoming more common, particularly the sort of patient who's coming back with recurrent symptoms for whom there's been no definitive diagnosis. And those symptoms might be something like abdominal pain or diarrhea, and possibly even flushing, or possibly even breathlessness. We know that 90% of neuroendocrine neoplasms are either in the small bowel or pancreas or in the lung. So just being aware of the diagnosis, and to that end, the International Neuroendocrine Cancer Alliance have put together a great educational video called Think NENs to help us to be aware of this diagnosis. It's a simple, easy to access, free educational tool that only lasts up to an hour, 3 modules of 20 minutes, and it's available for any primary care practitioner. In terms of diagnosis, what can we do most helpfully to cut that time between initial symptoms and diagnosis? Well, be aware of it. Maybe do the general screening blood test, because just occasionally anemia will be present, or the calprotectin will show inflammatory markers that are raised, but often that isn't the case. And what we really need to be doing when we refer these patients is to make reference to the fact, could this be neuroendocrine neoplasm? And to that end, the CT scan is going to be the most helpful investigation, the CT scan that needs to be looked at with the possibility of neuroendocrine neoplasm present. Because sadly, in my own case, I'd had the CT scan, the tumour was present, but it hadn't been noticed. And the reason it hadn't been noticed is that it wasn't particularly looked for. So please think NENs. It's a massively important diagnosis. You can make a huge difference to your patients if the diagnosis is made, because treatment is available. So I'd encourage you to learn more about it very simply by watching the free educational module. I think there are 3 things to say as to how we can really help in the diagnosis of neuroendocrine neoplasms. And I would put it simply like this. In a busy life and in a busy clinic, we do have to sometimes learn how to stop and just gather our thoughts and think, hang on a minute, what's going on with this patient? You may be aware of that poem that says, what is this life? If full of care, we have no time to stop and stare. And I've just recently taken up cycling with an e-cycle, and it's amazing what you see when you're going more slowly through the countryside. And I do appreciate in a busy clinic it's extremely difficult to do that. But I think if we're going to pick up these relatively rare conditions and not miss them, we've got to have that ability to think, what's going on with this patient that makes me need to just stop for one moment? But secondly, I think not just slowing down, but I think learning to look for something that you've become aware might be a possibility. Many years ago, when I was doing a check on a 6-week baby, it was a first baby. The parents were extremely proud of this little darling, and I rightly commented how beautiful the baby was, and everything was absolutely perfect after that I commented on. To which the mum said, should the baby have 6 fingers? And I hadn't noticed the extra digit on the hands, and I hadn't noticed it because I wasn't looking for it. So if you become aware of the possibility of neuroendocrine neoplasm as a diagnosis, you're much more likely to see it if you look for it. But the other thing to say, finally, not only do we need to stop and slow down, we need to look specifically for something, but we need to listen as well. And of course, listening to the patient is at the heart of primary care. And I'm sitting in my garden at the moment, and it would be very easy just to hear the noise of other people cutting their grass or whatever that they're doing. But in the background, there may be just that blackbird singing, and I need to just listen for it. And if I listen for it, I'll hear it. And if I can encourage you to just listen a little bit more closely to that patient who may just be giving you a clue that there's a diagnosis there to be made. And I hope you'll be successful in the journey. It'll be making such a difference to your patients. So I would encourage you to listen to the patient. Famously, Sir William Osler, the famous professor of medicine at Oxford over 100 years ago, said, listen to the patient. They're telling you the diagnosis. And we all need to learn to listen that little bit more closely to the cues and the clues that the patients are giving us that may help us point them to the diagnosis of neuroendocrine tumor.